Benefit Advisor TV Special Report. I'm your host, Bart Camarata. Today we're talking about the Affordable Care Act and what it means to you. Joining us via Skype is Will Haven from Haven & Associates in Corpus Christi, Texas. Will, welcome back. Now, we've been discussing the Affordable Care Act and what it means to the folks out there. But why is health insurance so important, and why should they enroll?
You know, it's a valid question. Having health care coverage is really about quality of life. For example, imagine having a health condition or even needing something like surgery and not having health care coverage to be able to pay for it. For example, and I'm going to give an accurate figure, a 3-day stay at the hospital is over $30,000. There's not too many people that can afford to pay for that with savings. Another example, if someone breaks their leg, that's a $7,500 expense. So really what healthcare coverage is designed to do is to help people pay for the unexpected. But in addition, healthcare plans through the marketplace are also designed to help pay for what are called preventive services. So for example, if someone wants to get an annual physical, they need to have vaccines either for the adult or for children. Those are also covered by the healthcare plan, including screenings and even prescription drugs. We do have another video about the specifics about what plans cover, but at this point, we're just trying to talk about how our quality of life and that of our children can be enhanced. Can you imagine, for example, if your spouse needs to have surgery and you don't have the money to pay for it? That's something that's going to weigh on your mind and your heart because you want to protect your loved ones, but you would be unable to do it without health insurance.
Will, isn't it also true that unexpected medical costs and emergencies are the #1 cause of bankruptcy in the United States?
Yes, in fact, that's an excellent point because my understanding is not having health care coverage and then going to the hospital, which the hospitals have to treat people. There's a law that says that. But on the other hand, that person has to pay for that health care treatment. So use the example of a three-day hospital stay. They will get hospitalized and they will get treatment. But imagine what's going to happen when they get a $30,000 bill a week later. Most people simply cannot afford that. If they don't pay it, it ruins their credit. And then if they file bankruptcy, that opens up another can of worms. But you are correct. The majority of bankruptcies in the United States are because people either don't have health insurance or they're underinsured. So having healthcare coverage, especially one of the new plans taking effect January 1st, people will have quality coverage, the same as if they had it at work or on their own, to be able to protect them. And it really protects them in two ways. First of all, you have what's called an out-of-pocket maximum. So for example, if you have a plan that has, let's say, a $1,000 deductible, and then it pays 100% after that, that means the most that you would have to pay in a calendar year for your healthcare expenses would be $1,000. Of course, that's just an example. There are different examples all the way up to over $6,000 out of your pocket. But the point is that you have a limit on how much you have to pay. For example, my brother had cancer, and in 1 year, his medical treatments were $312,000. So by having a cap on how much you would have to pay, you'll know in advance if you have something catastrophic, the most that you would have to pay out of your pocket. The second change under the healthcare law, and another benefit of having health insurance coverage, is that there's no limit to the amount of claims that an insurance company has to pay. For example, someone has a premature baby, that can cost over $1 million, but yet the insurance companies have the caps removed and they have to pay 100% of the care for that infant. So there's a huge advantage there in having health insurance coverage. But really, it goes back to peace of mind and quality of life. The second main reason to have healthcare coverage is to avoid the penalties. Beginning January 1st, 2014, if you or a member of your family does not have healthcare coverage, whether it's at work, Medicare, Medicaid, etc., your family, each member of your family will have to pay a tax penalty because you don't have healthcare coverage. And that penalty increases every year between now and 2016. So first of all, it's the right thing to do for yourself and your family to have healthcare coverage. The other thing is avoid the tax and buy coverage.
Thank you for joining us, Will, and answering our questions. If you are in the Corpus Christi area and would like more information about enrolling or need help signing up for health insurance, contact Haven and Associates at 361-852-8005. And don't forget that at Haven and Associates, they will work with you one-on-one, absolutely free. And until next time, I'm your host, Bart Camarata. Good night.